So let's go over twists, hip twists. And actually, I'm going to stop sharing for a moment and show you a hip twist. So we're going to go over just like the basics of a hip twist and the anatomy, and then we'll go over the technique a little bit more. So hip twists are exactly what they sound like. You're rotating your pelvis around the axis of the middle of your body, the axis of your spine. So one hip comes forward and the other hip comes back. It's happening in the transverse plane. And this is an action that you have to extra make sure that your knees are relaxed and bent enough that they are never going to be hyperextended in this movement. And you'll notice the knees absolutely do move. And because of some of the weirdness happening between the thigh and the pelvis here, which is a little bit out of scope, this is a movement during which the knees are relatively fragile. So if this hurts your knees, you can avoid it. You can slow it down, make it smaller, and make it softer. But if no amount of that makes it comfortable, just don't twist. One other thing I've heard can help and sometimes helps me is coming into releve. Sometimes that helps sort of stabilize the knees. You just have to make sure that the knees are still bent. And then twisting from releve sometimes helps make the knees feel a little more stable. Kind of depends on your body. Sometimes it makes it feel worse, sometimes it makes it feel better. So it's something you can try. You can also try stepping with it if that helps. Either stepping with the back portion or the front portion. Sometimes that helps. And sometimes you can even like you can kind of like rotate you don't want to have to rotate your thigh with it because then you can't like this is not actually going to help you move. You need to be able to like bump. So yeah, there's lots of things you can try. If nothing you try makes it feel good, don't do it. But yeah, that's the essential movement. So let's go over the anatomy. So I'll go back to sharing my screen. And this is almost all of this will be from getbodysmart.com, which was like my best friend in anatomy lab in college. So I love this site. It's free. It's um, intuitive, easy to use. Um, and when I emailed them asking if I could use their website in teaching videos, they said it was okay. So lots of good things. All right. So when the hip is twisting to the front, it is primarily being driven by the internal obliques. So this white thing, this can be a little bit confusing. This big old white thing here is called the aponeurosis, and it's a big old sheet of connective tissue, the same stuff that I think it is technically a tendon. It's just a large flat tendon, and the oblique muscles connect into it, and the obliques generally go kind of this way. So you can tell if this pulls this way, then that pulls the hip front, right? This pulls the hip front. So the internal obliques on the same side are going to drive the twist forward. And then the external obliques on the same side are going to rotate the hip, the hip back. So the external obliques are the opposite direction. And they also attach into this aponeurosis, which your rectus abdominis like sort of sits inside of. Yeah, so they come from the ribs and they have this sort of diagonal down. So if you think about it, if they're pulling this way, they're going to pull the hip back. So they twist it back. Now, both of these are going to sort of twist and lift unless you stabilize and prevent the lift from happening, which is what makes it, and part of what makes it in isolation. So this is part of why this move is, in my opinion, so difficult. Because, in my opinion, this is maybe the most difficult, like, foundational movement. And by foundational movements, we never mean easy, right? We just mean that they are the movements upon which the other movements are built. So, like, there's not another move that you need to learn the twist. That's what makes it foundational, in my opinion. This is my own personal terminology I'm using here, so if that makes sense. All right, and then getting into these little tiny deep muscles is a little bit out of scope for these videos. We'd be here forever. But know that the multifidus and the rotatoras. So this is where, I mean, Get Body Smart is a free resource. I could not find the rotatoras, and I don't know if I'm pronouncing that right because it's Latin, on that site. So I just went to Wikipedia. So this is Wikipedia's image. So there we go. You can see, like, it's the tiny little muscles that sort of like stabilize the spine and can aid in twisting motions. That's why they're called like rotators, like rotators. Yeah, so you can see I searched for that on. And it might be, sometimes there's multiple names for the same muscle, so it might be on Get Body Smart under a different name. But yeah, let me see if I can make this a little bigger. Just need to find the plus. Okay. Yeah, so you can see the multifidus is similar. It's also sort of like stabilizing everything in here. So if it's helpful to know that those little tiny spinal muscles are stabilizing and helping, and there are a couple other muscles, you know, just like in the abdomen and around and in the, like, the hip flexors that are somewhat involved. But in my opinion, really the ones I think about actively when executing the movement is that the internal oblique twists the same hip forward and the external oblique twists the same hip back. And by that logic, here, I'll go ahead and stop the share. It makes sense, right? So the pelvis, you can't move one side without moving the other. It's like a chest rotation, right? You can't move the right side of the chest forward without the left side of the chest going back. You can't move the left side of the hip forward without the right side going back. That's how it works. So therefore, if your internal obliques are twisting this hip forward, then the external obliques are also twisting this one back. So both obliques are involved in the twist always, because there's always one going back and one going forward, if that makes sense. So there's your anatomical breakdown, and then we will go into a technique breakdown in the next one.